हेलो फ्रेंड्स, वेलकम टू माय चैनल एपीआरिया नर्सिंग एजुकेशन। आज के वीडियो में डिस्कस करूंगा बॉर्न के बारे में। एक्चुअल में बॉर्न क्या होता है डिटेल एक्सप्लेन करूंगा। बॉर्न के क्या क्या कॉजेस होते हैं, बॉर्न की क्या क्लासिफिकेशन होता है, क्या इसमें सिम्टम्स देखने को मिलता है, कैसे इसको डायग्नोस किया जाता है और इसका क्या मैनेजमेंट है, ये सब सिंपल लैंग्वेज में डिस्कस करूंगा। टॉपिक स्टार्ट करने से पहले आप लोग मेरा वीडियो को लाइक, शेयर एंड सब्सक्राइब कर दीजिए और बगल में एक बेल आइकन है, उसको दबाएं ताकि आपको जब भी कोई नया वीडियो आएगा नर्सिंग एजुकेशन के रिलेटेड तो वह सबसे पहले आप तक पहुंचेगा। लेट्स डिस्कस द टॉपिक बॉर्न्स। बॉर्न्स क्या है? Burn is the transfer of energy from one source to another, which leads to tissue damage, destruction, protein denaturalization and ionization of content. मतलब बर्न एनर्जी ट्रांसफर करता है वन सोर्स टू अनदर, जिसके लिए टिश्यू क्षति विनाश हो जाता है, प्रोटीन अप्राकृतिकरण और आयनीकरण सामग्री की ओर जाता है। देन बॉर्न इंजुरी रिप्रेजेंट्स एन असॉल्ट ऑन ऑल एस्पेक्ट्स ऑफ द पेशेंट्स फ्रॉम द फिजिकल टू द साइकोलॉजिकल। मतलब बॉर्न की इंजुरी और बॉर्न की चोट फिजिकल और साइकोलॉजिकल सभी दिगों पर पेशेंट पर हमला दर्शाते हैं। देन द फिजिकल स्कार इज विजिबल एंड साइकोलॉजिकल स्कार इनविजिबल एंड लॉन्ग लास्टिंग। देन ह्यूमन स्किन कैन टॉलरेट 42 to 44 degree centigrade temperature, but above temperature the tissue destruction. Then bone injury are a significant public health problem. Then 4.5 to 23.5% with the highest mortality among the flam bone patients. मतलब 4.5 to 23.5% the highest mortality अग्नि ज्वाला से जले पेशेंट। देन डिस्कस इटियोलॉजी और कॉजेस ऑफ बर्न। ए बर्न इज ए टाइप ऑफ इंजुरी टू स्किन और अदर टिश्यूज caused by first thermal burn, second chemical burn, third electrical burn, फोर्थ रेडिएशन बर्न। और भी बहुत कॉजेस है बर्न की, बट डिस्कस 4 कॉजेस ऑफ बर्न्स। देन डिस्कस फर्स्ट कॉजेस ऑफ बर्न्स, थर्मल बर्न्स। These are caused by exposure to or contact with flame, hot liquids, semi-liquids, semi-solid और hot ऑब्जेक्ट्स। मतलब ये ज्वाला गर्म तरल पदार्थ और तरल पदार्थ और ठोस या गर्म वस्तुओं के संपर्क में आने से होते हैं। देन डिस्कस सेकेंड कॉजेस ऑफ बर्न, केमिकल बर्न्स। केमिकल बर्न्स caused by contact of tissue to any strong acids, alkalis or organic compounds. Then discuss third causes of burns, electrical burns. Electrical burns are the injuries caused by heat that is generated by the electrical energy as it passes through the body. मतलब इलेक्ट्रिकल एनर्जी शरीर से गुजरने पर उत्पन्न होने वाली गर्मी के कारण इंजरी होते हैं। then it can result from contact with exposed or fault electrical wiring or high voltage power lines. Then people struck by lightning also sustain electrical injury. मतलब बिजली गिरने से लोगों को विद्युत चोट भी लगते हैं. Then discuss last causes of burns. Radiation burns. Radiation burns are caused by exposure to radioactive source. Example: nuclear radiation accidents, use of ionizing radiation in industries, therapeutic radiation. Then sunburns from prolonged exposure to ultraviolet rays. मतलब सन की जो अल्ट्रावायोलेट रेज है उसके साथ लंबे समय तक संपर्क में रहने से सनबर्न होता है. सो दिस वाज कॉजेस ऑफ बर्न्स. देन डिस्कस क्लासिफिकेशन ऑफ बर्न इंजुरी. Classification of burn injury divided into two parts. First, according to burn depth, then second, according to extent of burn. Then discuss classification of burns. First, according to burn depth. According to burn depth, burns are classified into 4 degrees. Then each degree indicating the depth of tissue damage. First discuss first degree burns. First degree burns basically superficial partial thickness burns, and it mainly involves epidermis layer of the skin. Example: sunburn, and it is marked by redness, tenderness and mild painful. Then this is the important point. First degree burns typically heal within 3 to 6 days without scarring. Scarring मतलब mark और निशान. Then discuss second degree burn. Second degree burn basically deep partial thickness burns. Then it is epidermis along with upper and deeper portion of the dermis. Example: scald. Scald क्या है? Scald is a burn. Scald burn typically involve damage to the skin from hot liquids like water, steam or hot food. Then second degree burn affected parts of skin are all epidermis and 1/2 to 7/8 part of dermis. Then blister are mainly seen in second degree burn. Blister क्या है? Blister is a fluid filled bubble on the skin. Then second degree burn is white to pink or red in color and very painful. Then second degree burns typically 2 to 3 weeks to heal with minimal scarring. First degree burns heal without scarring, but second degree burns heal with minimal scarring. Then discuss third degree burns. Third degree burns full thickness burns. Then it is epidermis, dermis, subcutaneous tissue and even deeper tissue will be affected. Then it is painless because nerves are completely destroyed. Example: burn from flame and electric burn. Then third degree burns need is autografting and to heal take greater than 3 weeks. आपका मन में एक क्वेश्चन आ रहा होगा कि ऑटोग्राफ्ट क्या है. जब मैं ग्राफ्ट टॉपिक पर वीडियो पोस्ट करूंगा तो उस वीडियो को देखने के बाद आपको पता चलेगा कि ऑटोग्राफ्ट क्या है. So please first subscribe to this video. Then discuss last degree of bonds, fourth degree bonds. Fourth degree bonds involves all layer of underlying tissues including bones, blood vessels, muscles and nerves. Fourth degree bonds are painless because it destroyed nerve endings of pain in the skin. Then healing from a fourth degree bond can take months or even years and often involves skin grafting. So this was according to bone depth. These were 4 degrees. Then discuss second classification of bone according to extent of bone. According to extent of bone classified into 3 parts. First, rule of 9. Second, Lund and border chart. Third, Palmer method. Then discuss first, rule of 9. Rule of 9 is a method used to estimate the total body surface area of bone by assigning percentage in multiplies of 9 to measure body surface. Then discuss measuring extent of bones according to rule of 9s. First, anterior head and neck 4.5%. Then posterior head and neck 4.5%. Total anterior plus posterior 9%. Then upper limbs particularly hands and arms. Anterior 9%, then posterior 9%, total 18%. Then trunk, anterior 18%, posterior 18%, total 36%. Then lower limbs can involve thigh, knees, lower legs, ankles and feet. Lower limbs anterior 18%, posterior 18%, total 36%. Then perineum 1%. Then the rule of 9s is important in bone care. It is a quick method used by medical professionals to estimate the body surface area affected by a bone. Then it helps to calculate proper fluid resuscitation. Then discuss second extent of bone, Lund and border chart. The Lund and border chart is considered more accurate because the patient's age in proportion to relative body area size is taken into account. Then it is a tool useful in the management of bones for estimating the total body surface area affected both adults and children. Basically, Lund and border chart is a tool used to estimate the total body surface area affected by bones. Then Lund and border chart is compared to methods like the rule of 9. Then Lund and border chart particularly useful in children due to its age-related adjustment, and it is divides the body into different regions and provides age-specific area percentage for each, allowing for more accurate bone assessment. Then discuss last or third extent of bone, Palmer method. The Palmer method, also known as the rule of palms, is a quick and simple way to estimate the size of a bone, especially for small patchy bones. Then Palmer method involves using the patient's own palm, including fingers, as a reference, with each palm representing approximately 1% of their total body surface area. Then discuss diagnostic test of burns. बर्न पेशेंट का क्या क्या डायग्नोसिस किया जाता है? फर्स्ट, CBC कंप्लीट ब्लड काउंट. देन ABG आर्टेरियल ब्लड गैस टेस्ट. यदि आप ABG के बारे में अधिक जानना चाहते हैं तो आप साइट पर दिए गए वीडियो को देख सकते हैं, नहीं तो आप डिस्क्रिप्शन में जाके वीडियो को देख सकते हैं. देन कार्बोक्सी हेमोग्लोबिन. कार्बोक्सी हेमोग्लोबिन क्या है? कार्बोक्सी हेमोग्लोबिन refers to the hemoglobin which is combined with carbon monoxide instead of oxygen. Carboxy hemoglobin test measure the amount of carbon monoxide bound to hemoglobin in the blood. Then serum electrolyte test. Then alkaline phosphate. Then serum glucose and albumin. Then urine analysis. Then chest x-ray and lung scan. Then ECG, electrocardiogram. Then photography of burn. So this was diagnostic test of burns. Then discuss phases of burn care. Burn care is typically divided into three main phases. First, emergent phase or resuscitative phase. Second, acute phase. Third, rehabilitation phase. Then discuss first phases of burn care, emergent or resuscitative phase. Emergent or resuscitative phase क्या है? This phase of a burn injury begins at the time of injury and lasts until fluid resuscitation is complete. Typically within the first 24 to 48 hours after the burn injury. मतलब जलने की चोट का आकस्मिक चरण चोट के समय से शुरू होता है और तब तक रहता है जब तक कि फ्लूइड रिसक्सिटेशन कंप्लीट नहीं हो जाता है. Then typically within the first 24 to 48 hours after the burn injury. Then it focus on immediate life-saving measures like first airway management, second wound management, third pain management, fourth fluid resuscitation. But there are many more management, but these are four important. Then discuss first airway management. Airway management क्या है? Airway management is ensuring a patient airway is curable, especially in case of inhalation injury or circumferential burns to the chest. Then discuss wound management. Wound management क्या है? The burn wound should be cooled with cold or liquid running water for a short period to relieve pain and limit edema. Then covering the wound with a sterile dressing minimize the risk of infection. Then discuss pain management. Analgesics are administered to manage pain associated with the burn injury. Then discuss fluid resuscitation. Fluid resuscitation क्या है? Fluid resuscitation are used several formulas. The common formulas are include Parkland formula, modified Brocchi formula, Evans formula. But most commonly used and important formula for initial burn fluid resuscitation is the Parkland formula. Then discuss Parkland formula. Parkland formula क्या है? Parkland formula is used in fluid resuscitation, especially for burn patient. Then Parkland formula is a calculation used to calculate the total volume of fluids that a patient is going to need about 24 hours after receiving a severe burn. Then discuss formula. Parkland formula for adults. 4 ml into body weight in kilogram into percentage of total body surface area burned. Then Parkland formula for children, 3 ml into body weight in kilogram into percentage of total body surface area burned. Then Parkland formula is otherwise known as Baxter formula. Then discuss Parkland formula's time distribution. First, 50% of the total fluid is given within the 8 hours after the burn. Then remaining 50% is given over the next 16 hours. Then understanding the Parkland formula through examples. First, anterior trunk 18%, second anterior right arm 4.5%, then weight 80 kg. Then use Parkland formula in adults. Adults का Parkland formula क्या था? 4 ml into body weight in kilogram into percentage of total body surface area burned. TBSA कैसे निकालेंगे? Use the rule of 9 in approximating the TBSA. Anterior trunk 18% plus anterior right arm 4.5% equal to 22.5%. Then formula 4 ml into body weight in kilogram. Body weight in kilogram 80 kg is given into percentage of TBSA. Total TBSA 22.5%. Then 4 ml into 80 into 22.5% equal to 7200 ml. According to time distribution of Parkland formula, 50% of total fluid is given within the first 8 hours after the burn. 7200 ml 50%, 3600 ml. 3600 ml is given first 8 hours. Then remaining 50% is given over the next 16 hours. 7200 ml next 50%, 3600 ml given next 16 hours. Total fluid 7200 ml. 7200 ml का 50% 3600 ml. 3600 ml given first 8 hours. Then other 50% 3600 ml given next 16 hours. So this was the Parkland formula. I think you have understood the Parkland formula well. If you still do not understand, then comment me in the comment box. Then I will clear all the doubt. Then discuss other two formula. These are not important but discuss. First, modified Brockie formula. Modified Brockie formula is similar to the Parkland formula but recommends a lower volume of fluid. Typically 2 ml into body weight in kg into percentage of total body surface area for adults. Then discuss another formula, Evans formula. Evans formula uses a combination of normal saline, colloid and dextrose in water. So this was emergent or resuscitative phases. Then discuss second phases of burn care, acute phase. After the initial shock has passed until the bone is fully healed or skin grafting is complete. Then acute phase focus on wound care, infection prevention, nutritional support, physical therapy. Then discuss third phases of bone care. Rehabilitative phase. From the time the bones are healed until the patient has reached optimal physical and psychological recovery. Then it focuses on physical rehabilitation, scar management, return to function. So this was phases of bone care. Then discuss complication of bones. बॉन पेशेंट में क्या क्या कॉम्प्लिकेशन देखा जाता है? फर्स्ट, इन्फेक्शन, फ्लूइड लॉस, ब्रीदिंग प्रॉब्लम, कार्डियोवास्कुलर इश्यूज, स्किन कैंसर, न्यूरोलॉजिकल इश्यूज, हाइपोथर्मिया, organ failure, bone and joint problem, then pain. In this video, we learned about bone. I suggest you please watch the video first to last. I think this video is very helpful for you. I hope you understood this video. Any doubt, please comment me on comment box. Then I will clear all doubt. आप चाहे तो मेरा टेलीग्राम चैनल ज्वाइन कर सकते हैं, लिंक आपको डिस्क्रिप्शन पे मिल जाएगा. If you understood this video, then please like, share and subscribe my channel. Thank you for watching.